If you recently received an inflatable penile implant, you might have heard that cycling your implant is important. Today, I will share with you 7 things you need to know when it comes to cycling your inflatable penile implant. Hello everyone, Jonathan Clavell here again, urologist and penile implant expert in Houston, Texas. Cycling is a term we use for inflating and deflating the inflatable penile prosthesis. If you have a malleable implant, this video does not apply to you. Here are 7 things you must know when it comes to cycling your penile implant soon after surgery. Number 1, when you start cycling, try to deflate first. If your pump has been semi-erect and without any fluid transferring through the valve, it will be easier if you get the valve wet by deflating it first. Trying to inflate first might be difficult and you may feel like the bulb is too hard to squeeze, so try deflating it or getting the penis down or soft first. Easiest way will be pressing and holding on the deflated valve while with your other hand you squeeze on the penis. Let me repeat that. Press and hold on the deflate valve while with your other hand you squeeze your penis. Number 2, pain. When inflating and you are trying to get it hard, it is normal for the penis to hurt a little bit. Remember, you are stretching the tissues on the inside. If you have a knee surgery and you are going through rehab, it is expected for you to have some discomfort at the beginning. Same thing goes with the penis. Number 3, no need to be super gentle with the pump. Many men tend to make the mistake of being too cautious with the pump, thinking that they might break the pump or pull on the tubing. It is extremely unlikely that you will break something in there, so do not be scared to feel for it. Try massaging the area to move the testicles away from the pump so you can get a better grasp and grip of that pump. Like similar to a blind person who relies on touch and needs to feel things well in order to get to know or identify something, you need to touch and feel around your scrotum to figure out where the pump is located and where its parts are. Sometimes the pump will be behind the testicles, sometimes it might be in front, other times in between the testicles. Sometimes the pump can rotate. The button can be facing to the left, sometimes to the right. Do your best to identify all the parts of that pump. Do not call your surgeon asking what's the orientation because sometimes the pump can rotate and move while you're healing. But no worries, you are unlikely to break anything while cycling. Number 4, there is no magic number for the amount of pumps to inflate. The amount of pumps depends on 2 things. Number 1, how hard you are squeezing on the bulb, and number 2, how big those cylinders are. If you give it a full squeeze or if you have a narrower or shorter penis, it will take you less pumps to get it up. If you have a wider or longer penis, or if you are only giving it the pump what we call baby bird squeezes, then it will take you a lot of pumps to get that implant full and hard. Number 5, the more you cycle, the easier it will get. The pump does tend to get softer with time, so keep at it. Don't get frustrated, because like most things in life, the more you do it, the better you will get and the easier it will be. Number 6, warm baths will be your best friend. At the beginning, while you are still healing, you will have some swelling, the scrotum might feel tighter, and it may be difficult for you to identify the different parts of the pump. Getting into a warm bath will help loosen up the tissues and may help you cycle. So if you find yourself struggling to cycle, try it in a warm or hot bath. Be careful not to burn your skin though, so don't get the water too hot. And number 7, everyone struggles. Like everything else in life, it takes time for you to get used to it. Do not expect to become an expert right away. It will take time for you to cycle as quickly as your surgeon. Initially, it might take you several minutes to inflate and deflate, but try to be patient. We are hopeful that you will get it. Soon enough, you'll be able to cycle within seconds. Still have questions? Feel free to write those down in the comments below. Make sure you also visit the rest of our YouTube channel to learn all about penile implant surgery. If you're looking for a surgeon, we're here for you. See you next time.